there's been mixed reaction to the President's signing of the NHI Bill into law yesterday. Health Minister Dr Joe Phaahla saying that government is finally at the starting line when it comes to universal healthcare access. So Claude Naiker is the spokesperson for the Public Servants Association, and Sicina, President of the Health and Allied Workers Indaba Trade Union, join us live now to be able to talk about this. Thank you so much for your time. I'm going to start with you, Claude. The President saying that the state is trying to build, and I quote, a Rolls-Royce system of healthcare for all South Africans. Is that the case in your view?
Yeah, thank you for having me, and good evening to you. It must be emphasized that we're not against the national health insurance. We've always advocated that the delivery of quality health services for all citizens of a country should be based on your health needs and not your economic status. What we were advocating is that the President delays the signing of the National Health Insurance Act till we get a number of things clear. In your presentation earlier, you've heard the gentleman actually indicated how is the National Health Insurance going to be funded. One of the ideas that is being mooted is to increase the tax of ordinary citizens. Currently, ordinary employees are grappling under the economic conditions and are basically surviving on a day-to-day basis, trying to get the basic economic needs and basic commodities in order for them to survive. An increase in income tax is certainly going to affect them. And in the public sector where we engage on a daily basis, we've been receiving public servant salary increases that are not just below inflation, but below a real wage increase. And public servants on the whole have been struggling to try and make ends meet. So that is one of the areas of concern that we actually highlighted and said, why rush the act? Let's try and get some sort of clarity around how the funding structure is going to work, so that we can have a clearer picture as to whether the health system or the national health insurance is going to work. We want a system that's going to work. We want a system that's going to be successful at the end of the day.
Rich, pardon me, Claude, let me bring in Rich for his reaction then as well, because I mean, Rich, when you listen to the health minister, for example, he says that this is the first step, and then the president saying that it's a bold step and stride towards a society where no individual must bear an untenable burden while seeking medical attention. How then does your union react?
Thank you, my leader. As Health and Allied Workers in the Trade Union, we are clear. We are clear that we are welcoming the signing of the bill. We advocated for it a long time ago. We are saying as long as in South Africa we have a two-tier system, we will still have this public healthcare sector in particular neglected and dysfunctional. Because obviously those in positions of authority, including the president, by the way, the ministers, MECs, CEOs, and many managers in the public sector space, all of them have medical aids. Almost all of them have medical aids. When they are sick, at their most vulnerable state of sickness, they go to private sector, running away from the same healthcare facilities they are heading. That is why there's this dysfunctionality within our healthcare system, and gross shortage of staff and gross shortage of material resources. It's because we know Cyril Ramaphosa is not going to come to tell them, for example. But we saw what happened in Steve Biko, because Mutsualedi didn't have medical aid, opted to not to have medical aid and said, I am going to use the same public healthcare system. In that particular ward where Minister Mutsualedi will be admitted, everything, my leader, will be hunky-dory. You will never run out of even a syringe, because we know the minister is coming there. And we realize there's not an allied workers in the trade union that, you know what, if we are singing under the same hymn, if we are all depending under, we are beneficiaries of one sector, this sector will actually function like a well-oiled machine.
So, Rich, I don't want to lose the point that you've just made. I want to make a follow-up on that. You say that, of course, they're not going to be using this particular healthcare system. So why should South Africans then trust it, if they themselves are not going to be trusting it?
That is why, my leader, we are clear as well in saying we hear the concerns on the ground. That is why our South Africans are concerned. That is why our South Africans are saying this, even in our corridors. Today, we were speaking with nurses and doctors, are saying, no, man, we are rejecting NHI because it's going to come and collapse the healthcare system. We are saying it's imperfect, obviously, and it's embarrassing on the side of the ANC, by the way. That is why there were submissions, my leader, there were submissions that were submitted by political parties, ourselves included, to say this bill, in its current form, it's imperfect. Let's fix it. But ANC didn't do that. Now they want to use it as a political ploy so that they can get votes on the 29th of May.
So, Claude, then, as we're now going to be wrapping up, let's then stay with that particular point, because if we have now seen the history of the NHI, we've also seen some pilots as well in 10 districts, and we're still here with a lot of questions about how it's all going to work. Why are we still stuck with questions years on after all these things should have been ironed out?
Absolutely. It's a very critical question that you asked, and this is the question that the PSA has asked, that we want to see the system work, but there's groundwork that you need to put in place first. Our infrastructure at the hospitals and the clinics is not on par to deliver quality services. I think more money needs to be invested in infrastructure, and more importantly, there is a critical shortage of health personnel in our country. Day in, day out, you see doctors are taking to the streets saying that they don't have jobs. How are you going to implement the national health insurance if you do not have the personnel to deliver on the system? Yesterday, we had social workers that have taken to the streets, that have graduated, but they don't have jobs. I think the basics needs to be done first. As the PSA, what we are saying is that let's get the basics done. Let's sort out our critical shortage of staff. Let's sort out the infrastructure. We will deal with the funding at a later stage, and then we can talk about the more complex issues. Of concern to us as the PSA is that a lot of hospitals, in your presentation earlier, it was highlighted, a lot of hospitals have not managed the resources well. If you get a small hospital and a clinic that is unable to manage the resources, here you come up with a very huge fund with lots of money. It's going to be prone to maladministration and corruption. We've seen it in the past, and we hope that the national health insurance is not going to go in the same direction itself. We want it to succeed as the PSA. As I said earlier, health system should be based on your health needs and not on the economic status of an individual of our country.
Gentlemen, the conversation doesn't end here. We certainly are still going to be speaking about this one, because there's a whole lot that still needs to be unpacked as far as this conversation is concerned. But let me thank you tonight for getting us started with this conversation, and I do hope we speak again. That is Rich Sicina, the Health and Allied Workers Indaba Trade Union President, and also at the same time we also had Claude Naiker, the spokesperson for the Public Servants Association.